Good morning, everyone. Today we'll be discussing a new system, the female genital tract. The first lecture will be about vulvar diseases. This is a quick review of the anatomy of the female genital tract. The lower genital tract starts from the vulva, not shown in this image. The vagina is this tube that connects the outside the vulva into the uterus. The uterus is divided into the cervix and the corpus, or the uterine cavity. These are connected to the ovaries through the fallopian tubes on each side, and the ovaries are attached by an ovarian ligament. The vulva is the external female genitalia and includes the moist hair-bearing skin and mucosa in that region. Disorders can be divided into inflammatory, which are common, typically present with discomfort, itching, and redness, and they are rarely serious. On the other hand, malignant disorders are rare, but they are serious and life-threatening. The most common inflammatory disorder of the vulva is vulvitis. It is typically a reaction to irritation by an exogenous material, whether this material was an irritant or an allergen. In either case, both of these diseases have the same manifestations. These include well-defined erythema and severe itching. And one of the prime examples of this is the diaper rash, typically seen in almost all children when they wear diapers. Notice the presence of well-defined erythematous swollen region. This is also typically itchy. Vulvitis can be caused by infection. The vast majority of these infections are sexually transmitted. These include HPV. HPV stands for human papillomavirus, which is the causative virus of condyloma, vulvar intraepithelial neoplasia, and squamous cell carcinoma. Herpes simplex, typically herpes simplex 2, is a sexually transmitted disorder as well. It causes a blistering disorder of the genital tract, including the vulva. Neisseria gonorrhea is a bacterium, and it causes suppurative infection of the vulvovaginal glands. Treponema pallidum, which is the underlying causative organism of syphilis. It can be primary, secondary, or tertiary. The vulva is associated with a primary chancre at the vulvar site of inoculation. Candida, also known to cause vulvitis, it's a fungal infection, but unlike all the previous organisms, it's not a sexually transmitted disorder. One of the complications of vulvitis is the obstruction of the excretory ducts of parathalamic glands. This blockage may result in painful dilatation of the glands, and if this cyst becomes infected, an abscess might form. Some not very uncommon non-neoplastic epithelial disorders can affect the vulva. These disorders typically affect elderly postmenopausal women. Most of the time we don't have an obvious causative etiology, and they are benign, but they carry a small risk of developing squamous cell carcinoma. This risk is estimated at 1 to 5%. We will discuss two of these non-neoplastic lesions, lichen sclerosus and lichen simplex chronicus. Lichen sclerosus occurs when there is atrophy of the skin. It becomes thin, light in color, and since they are thin, they cannot protect the underlying blood vessels, which results in small bleeds causing bruises and cuts. Histologically, this disease is characterized by thin epidermis, complete attenuation of the rete ridges, vacuolar or hydropic degeneration of the basal layer of the epidermis, fibrosis of the dermis with variable amount of inflammation. Lichen simplex chronicus is a nonspecific change seen as a consequence of chronic irritation, specifically itching due to whatever cause. Infection, lichen sclerosis, etc. Or other forms of general skin dermatosis such as eczema, which affects skin in other regions, but it can also involve the vulva. Grossly, it is similar to lichen sclerosis, whitish, pale lesions of the vulva. They do not have an increased risk of malignancy, but it is very important that lichen simplex chronicus can arise in an adjacent area to a malignancy. And that's why, in all of these cases, biopsy is vital. Histologically, lichen simplex chronicus is characterized by increased thickness of the skin, in other words, acanthosis, with hyperkeratosis and variable amounts of dermal inflammation. When discussing epithelial neoplasms of the vulva, we will discuss briefly condyloma, carcinoma of the vulva, and extramammary Paget disease. Condyloma refers to any warty growth of the vulva. This is an example of a severe case of condyloma. Notice the polypoid, cauliflower-like growth of the epithelium. The condyloma could be single or multiple. It can be small, submillimetric to several centimeters, and it can occur anywhere in the anogenital tract. The condyloma is caused by low-risk human papillomavirus infection. Microscopically, condylomas are composed of acanthotic skin, which means skin with increased thickness of the epidermis. Notice the coilocytes in the middle of the picture. These are epithelial cells with a clear halo around the nucleus. The nucleus itself is enlarged, hyperchromatic, and irregular. To have a feel of the abnormality of these cells, notice the cells in the middle of the image to the ones on the left-hand side of the image. These are the normal ones, and the ones in the middle are abnormal. As I discussed, these are associated with low-risk HPV strains, specifically 6 and 11, and they do not transform into malignancy. Carcinoma of the vulva, it's kind of rare. They represent 3% of the female cancers. They usually affect women older than the age of 60. And the vast majority of them are squamous cell carcinoma, although a minority can form adenocarcinoma or basal cell carcinoma. Squamous cell carcinoma of the vulva has two major pathways. The first pathway, which is the more common one, it affects older women. It has no association with human papillomavirus or vulvar intraepithelial neoplasia. It has a background of reactive conditions or lichen sclerosis, and is typically well differentiated and highly keratinizing. Quick word about vulvar intraepithelial neoplasia, VIN. This is a precursor lesion similar to carcinoma in situ that we see in other organs, and it has something to do with human papillomavirus or the second pathway, as we will see in a minute. The second pathway is less common. It affects middle-aged women. It is associated with high-risk HPV 16 and 18, especially if these women have other risk factors, specifically smoking. This is associated with VIN, meaning that the human papillomavirus does not transform the epidermis into malignant from the start. It goes through a series of changes from hyperplasia to vulvar intraepithelial neoplasia, low grade to high grade to invasive malignancy. Unlike the first pathway, these tend to be poorly differentiated tumors. Extramammary Paget disease is a proliferation of malignant epithelial cells within the epidermis. Remember, we mentioned Paget disease of the breast, and we said it is associated with an underlying malignancy in almost all the cases. Half of these are ductal carcinoma in situ, the other half is infiltrative invasive ductal carcinoma. Unlike the breast, the the vulvar Paget disease or the extramammary Paget disease does not have an underlying malignancy. Under the microscope, similar finding to the mammary Paget disease, we find large cells infiltrating the epidermis, and the patient presents with red scaly plaques similar to eczema. The clinical significance of extramammary vulvar Paget disease, it is to differentiate it from melanoma. Melanoma is a highly malignant, highly fatal uh, neoplasm, and extramammary Paget disease is not. So it is very important to differentiate between the two to further dictate and characterize the treatment because they're vastly different. One of the ways to differentiate between the two is PAS stain for mucin, um, which is positive in Paget disease and negative in melanoma. Extramammary Paget disease persists for years with no invasion, and if in rare cases metastatic disease happens, which can happen very rarely, then the prognosis is poor. This was the first lecture. I would like to thank all of you for listening, and please, if you have any questions, please do not hesitate to ask me. Thank you very much.